Yesterday, I was excited to start our second regular session of Congress and hear the SONA of our president. For those who were going to attend the SONA physically in the House of Representatives in the session hall, were supposed to be tested for COVID-19 using a PCR or a swab test. We understand that the procedure was for the health, safety, and security of all those attending the SONA, particularly our President Rodrigo Roa Duterte. So we came early in the Senate to have our swab test taken, of which the result could come out before the start of the State of the Nation address. Later in the day, Mr. President, I was approached by our medical bureau director while about to finish lunch with some of our colleagues to inform me that the PCR test result conducted by the Lung Center of the Philippines. She informed me that my PCR test yielded a positive result. I was alarmed and I thought to myself, oh no, not again. I immediately informed our colleagues whom I was having lunch with for them to quarantine, as well as with my apologies. I had to apologize to the gentlemen and ladies who were with me during lunch. After informing them, I followed protocol, immediately headed home and decided to isolate myself and not attend the SONA physically anymore. On my way home, I was reminded by what happened to my dear colleague, our dear colleague, and a fellow COVID survivor, Senator Sani Angara. I remember that after his long quarantine in May and recovery period, he was swab tested as he was about to donate plasma in St. Luke's, and his test yielded positive as well for COVID-19. His doctors and some experts stated that this positive result could be attributed to the remnants of dead COVID-19 viruses in his body, which some PCR machines could not detect or distinguish if the COVID viruses, or if they can distinguish if the COVID viruses are dead or live ones. I know as well of other recovered patients who've had the same experience, particularly my friend Edgar Gatchalian, no relation to Sherwin Gatchalian, who had 16 swab tests. Imagine, 16 swab tests due to recurring false positives. So on my way home, I thought of having another confirmatory test. It's like getting a second opinion, so to speak. So I contacted our untiring Red Cross chair, no other than Senator Richard Gordon, and asked if we can have my confirmatory RT-PCR test with them. The results of the Red Cross PCR test on me was released this morning, and I'm happy to say I was COVID negative.
I'd like to place on record a letter that I have just received just a few minutes ago from the Department of Health, directed to the Senate President, and it is signed by the Secretary of Health, Francisco Duque III, and this is, he says, reference to the request for recommendations to the Senate of the Philippines after Senator Juan Miguel Zubiri tested positive through GeneX last July 26 after consulting with the department's Technical Advisory Group for COVID-19. The following are advised. Number one, it should be reiterated that polymerase chain reaction is very sensitive and can detect the virus and virus genetic materials remnants. It's also best used for symptomatic patients. Due to the test's sensitivity, the PCR result of Senator Zubiri can be remnant of the virus. It can also be a false positive result and or cross-contamination. There are two other paragraphs here that I will submit into the records, but the important thing is, I think, is number 3. Number 3 says, those who are close contacts of the senator need not necessarily be quarantined, since this is most likely not a true infection. As a layer of safety, close contacts may be tested using PCR 5 days after their last contact with senator, but it is not necessary. Therefore, all right, just 2 or 3 more sentences, but I think the most important point is that we'll give the Senator Zubiri a copy of the letter from Secretary Duque. So, Senator Dillon, you have no problem.
Mr. President, thank you very much. You have elated me to, I'm elated today and very, very happy with the letter of Secretary Duque. I appreciate that. But nevertheless, I'm still going after this to take my ELISA test just to be absolutely sure It's arranged already at the Red Cross port area, Mr. President, just to be absolutely sure and to assure my colleagues that no harm will come to them.
All right.
They will be as healthy as ever.